Hello, my group was assigned to research the monogenic disorder Duchenne muscular dystrophy, which is the rapid deterioration of muscle tissue. Genetic disorders are not something that you can prepare for unless preemptive steps are taken to discover and diagnose any chromosomal abnormalities that the parents can possibly pass down to their children. It requires the use of advanced technology like DNA tests, muscle biopsies, and prenatal tests. Through the research on this disorder, I found that even though this is a rare disease, it still affects so many children and families worldwide. For the DMD gene itself, it stems from the death and muscle weakness by a defect in the human DMD gene, which is the largest known human gene. Even though this disorder primarily affects males, it can still affect females. And according to the National Human Genome Research Institute, there have also been recent cases that tell of even female carriers that can still show symptoms of DMD.
And now the DMD gene is important because it produces a protein called dystrophin. Dystrophin's function in a normal body functions as an anchor between the extracellular matrix and the cytoskeleton. In layman's terms, what that does is it basically strengthens and elongates muscles when they contract and relax when you're doing your typical movements. The dystrophin protein is typically found and mostly found in skeletal muscles, your movement muscles, and also in the cardiac muscle. Trace amounts of dystrophin are also found in brain cells, but at this point we don't know exactly the role there. Now, in a patient with Duchenne's muscular dystrophy, what happens is the gene mutates by deletion, and then the body no longer produces this dystrophin, so there's no anchor between the matrix and the cytoskeleton. How this is presented in the human body is first exhibited in the early childhood stages, around the ages of 3 to 6. What we'll notice first in a Duchenne patient is there'll be some difficulties with climbing, walking, getting up from the ground. You will see something called the Gower complex, where the child will have to sort of walk his arms up to his legs, bring the bottom up, and pull himself up off the ground in order to lift from a seated or a standing position. That is the primary thing that we notice at the early stages. Now, in the later stages, around, let's say, ages 7 to the ages of 12, the preteen ages, the degeneration and the lack of dystrophin protein ends up affecting all the skeletal muscles, primarily around the trunk and legs, which presents difficulties in walking, where a Duchenne patient is typically wheelchair bound before their teenage years. Now, as Duchenne progresses in a human body, around the teenage years is also when the dystrophin protein, or lack thereof, starts to affect the cardiac and respiratory muscles. So you will see the symptoms, you'll see difficulty breathing, increased fatigue. Additionally, you'll see an enlarged heart, and then what that leads to ultimately is a near-fatal disease called cardiomyopathy.
Cardiomyopathy is a disease of the heart muscle that makes it harder for your heart to pump blood to the rest of your body, which can lead to heart failure. There are no known cures for it. They only can be stabilized or slowed down by medication or septalmectomy, which is an open heart procedure in which a surgeon removes part of a thickened, overgrown septum between the ventricles, removing part of overgrown muscles, improving blood flow in your heart. And septal ablation, which is a small portion of thickened heart muscle destroyed by injecting alcohol through a long, thin tube into an artery.
Overall, Duchenne muscular dystrophy, DMD, is a rare X-linked recessive inherited disease caused by a mutation that affects men more than women and has fatal symptoms leading to a premature death. Modern medicine and the use of a respirator has extended the survival rate by a decade or two, allowing the affected to possibly live to their 30s, but relying on a machine to keep them alive.